At Vertrae, a spine-only practice right in Dayton, Ohio, the team works with patients every single day who are trying to figure out if spinal cord stimulation might be the right path for them. And honestly, there are a lot of questions. Plus, a fair amount of fear usually builds up around a treatment that most people have never had clearly explained to them. Patients often walk through the clinic doors carrying skepticism or assuming they're only having this conversation because absolutely nothing else has worked. To help ease that very normal fear and confusion, the Vertrae team is completely dedicated to clearing things up. They do this by directly tackling the questions they hear the most. They provide honest, straightforward information without the confusing medical jargon, without any rehearsed scripts, and, most importantly, without any pressure. It is all about making sure patients truly understand their options before making a single decision. So here are the questions the team hears time and time again. The very first question is almost always the exact same. Is this a last resort? At Vertrae, the answer is a definitive no. Spinal cord stimulation is an evidence-based treatment, not some desperate end-of-the-road measure. It definitely is not what a patient chooses just because they have completely run out of ideas. The crucial point here is that spinal cord stimulation is the appropriate treatment for an appropriate kind of pain, specifically neuropathic pain. That is the burning, shooting, almost electric kind of pain that travels right along a nerve path, and that hasn't responded to several months or more of conservative care. It often just persists even when resting. For a patient experiencing this signature type of pain, spinal cord stimulation is not a last resort at all. It can simply be the exact right tool for the job. The second question is usually, how does it actually work? The Vertrae team explains that the procedure involves placing small leads, which are essentially just very thin wires, right alongside the spinal cord. Those leads then deliver gentle electrical pulses that can actually interrupt the pain signal before it ever reaches the brain. It is kind of like intercepting a message before it can even be read. What is incredibly interesting here is the clear distinction between approaches. Spinal cord stimulation does not fix structural problems in the spine. Instead, it changes how the nervous system carries pain. That is a massive distinction. It delivers absolutely no medication, meaning it carries none of the side effects you might see with drug-based approaches. The effect is purely neurological. Okay, the third question is all about the trial. And this is honestly one of the things that sets spinal cord stimulation apart from almost anything else in medicine. From a patient autonomy standpoint, it is totally extraordinary. Before any patient commits to anything permanent whatsoever, the therapy gets tested in real life. Here is exactly how that trial works. Temporary leads are placed and connected to a small external generator that is just worn on a belt or clothing for about a week. Then, the patient simply goes about living their life. They test the therapy under everyday conditions, walking, sitting, sleeping, and doing the exact movements that typically aggravate their discomfort. It is the perfect way to see exactly how the body responds. If the trial brings meaningful relief and real functional improvement, the conversation naturally moves toward the permanent implant. But if it doesn't, the leads just come right out. It is a completely clean exit. Nothing permanent was ever placed. The patient gains a clear, definite answer either way without any lasting risk or major surgical commitment. Naturally, the fourth question is what the trial actually feels like. It is completely normal to have physical anxieties about a new procedure, right? But most patients actually find the whole experience much, much easier than they expected. The temporary leads are placed in an outpatient setting under local anesthesia, with just some light sedation so the patient remains completely comfortable. Once it is active, traditional spinal cord stimulation can produce a mild tingling or buzzing right where the pain used to be. However, a lot of the newer systems remove that sensation entirely. They deliver the relief without the patient feeling the device working at all. Many patients return to the clinic after their trial week expressing immense hope. Hearing someone say, "I wish I had done it sooner," is incredibly common. Experiencing a reduction in discomfort after months or even years of struggling, that can be truly life-changing. Moving forward, the fifth question is whether the system can be removed if a patient changes their mind down the road. The answer is yes, fully and completely yes. Spinal cord stimulation is one of the very few interventional pain treatments that is fully reversible. For anyone worried about making a permanent change to their body, this fact provides immense peace of mind. It is fundamentally different from a major structural intervention, like a spinal fusion, where changes to the anatomy genuinely cannot be undone. The permanent system consists of two main parts: And both the leads and the implanted generator can always come out. That option remains on the table forever. If the therapy is no longer needed, or if a patient simply chooses to discontinue it, the entire system can be safely removed in a straightforward outpatient procedure. There are plenty more questions patients bring to these consultations. But the most important takeaway is this. These are all answerable questions. The Vertrae team welcomes every single one of them, without pressure, without rehearsed scripts, and with the exact kind of honest information patients need to make the right decision for themselves. The evaluation always starts with a thorough review of the patient's history and pain pattern before anything is ever scheduled. That is just how the team works at Vertrae. What could life look like with an honest, clear answer about pain? The trial exists so that patients can answer that very question for themselves, with their own body, in their own daily routine. Vertrae, Dayton, Ohio. Schedule your motion-first evaluation at vertrae.com.